Hi, good evening, students. We are going to continue balance portion of tissues and its classification. Already we started first unit of anatomy and we completed first essay, that is structural functions of cell, and the second essay in that unit, that is tissues and its classification. Before that we completed the positions and the cavities, everything we completed in the first video, and this is the day 6 class. So whereas balance 5 days, if you didn't watch, you just go and watch first that 5 days class. After that you come to this video. Otherwise it will be very difficult you to understand this one. Okay, this video is only for first semester students, or those who are going to write first semester exam, or those who are going to write anatomy and physiology exam. Okay, and these classes are very useful for all nursing student, including GNM, BSc in India. Okay, whether you are studying in Kerala University, or you are studying in Rajiv Gandhi University, or any other, whatever it is, in which state, any university, you are studying the same topics, and same you are following the all colleges, all universities are following the same syllabus only. So for everyone, those who are studying BSc Nursing, it is very useful. Okay, and other than this, I want to tell you that while you seeing these videos, don't skip the video. If you are not through with this topic, don't skip the video. If you are skipping the video, then you will not understand what I am teaching. So just find time and sit and listen the class and make short notes. These short notes will be useful for your public exam. Okay, and once I completed class, I will take classes about previous year questions also. It will be very useful for your preparation, final preparation in the university exam. Okay, and don't waste your time. You have only you have only 6 months to study 4 subjects. That means two subjects in each paper. Okay, so much is there to study, but you have interest, and if you are ready to study, I am here ready to teach you. Okay, we will continue the classes. If you like the video, please like it, and if you have any comments or suggestions, you please write it. And if you didn't subscribe, please subscribe if it is useful, and share with your friends also. Okay, now we'll start the class. Yesterday we finished till actually yesterday we started connective tissue. In that, several classification is there. Everything I explained in the yesterday's class. Today we are going to study dense connective tissue. In that classification, dense connective tissue we are going to start. Okay, dense connective tissue mainly divided into two types, that is fibrous tissue and elastic tissue. You will get 2 mark question from this topic, the difference between fibrous tissue and elastic tissue, or you may get MCQs like examples for elastic tissue or fibrous tissue, or you may get questions like essay 10-mark questions like tissue, what is tissue, what is the definition of tissue, and what are the classification of tissue, like that they will get asked, and 5-mark questions also you may get. Okay, now, okay, first we will study from textbook, then we will come to short notes. I said itself, every day I am telling why I am choosing textbook means, if you people have to read text, otherwise you will not understand. First you should go for detailed study, and then you go for short notes. And if you are choosing only short notes means it's not at all enough. Then when you are getting exams, and if you are facing different types of questions, and when once for MCQs and all, it's very difficult. So read textbook, don't go for short notes directly. You don't go for short notes. First you read textbook and study from that, understand the topic, then you go for short notes. Okay, here we can see dense connective tissue. This is one type of connective tissue, that is dense connective tissue. This contains more fibers. Already yesterday we studied loose connective tissue, adipose tissue, is it reticular tissue, everything we studied, and the cells in the connective tissue also we studied yesterday. Here you can see dense connective tissue. The word itself is showing like dense. That means the thickness or hardness of connective tissue is more. Okay, there are two types of dense connective tissue. That is, first one is fibrous tissue, and second one is elastic tissue. Okay, clear? Fibrous tissue. What is the specialty of fibrous tissue? This tissue is made up mainly of closely packed bundles of collagen fibers. Because every connective tissue is having collagen fibers, but in this fibrous tissue, it have closely packed bundles of collagen fibers with very little matrix, very less fluid will be there. It have more collagen fibers. Okay. Fibrocytes, old and inactive fibroblasts are few in number and are lie in rows between the bundles of fibers. Fibrous tissue is found, and it is found in forming ligaments. It found in ligaments and periosteum, in the protective layer of different organs, and muscle sheath, muscle fascia, and tendon. In these areas and all, we can see fibrous tissue. You may not, sometime you may not be knowing these things, these words, but don't worry, just not these words now. Once you comes through the anatomy of each and every system, you will come to know these words. Okay, now I will give small idea, but you don't get tensed. Okay, fibrous tissue means it is made up of, this tissue is made up of closely packed bundles of collagen fibers. Is it collagen fibers? It's very little matter. That means it is thick. It is thick and a little bit harder. Okay, harder than loose connective tissue. Harder than loose connective tissue. Where and all we can see it is found in ligaments. Ligaments means it is some tissue connect bones together. Okay, bones. In our body we have many bones. Here two bones are coming together. Something had to be there to fix these bones in the correct position. This is called ligaments. Ligaments are tissues that connect two bonds together. This is an important one word question, that is MCQ. What is meant by ligaments? Ligaments are the tissue, special tissue connects or bind bonds together. It connects bond to bond. Okay, and then what is meant by periosteum? Periosteum means, okay, and the ligaments means more, these tissues connecting bonds together. And what is meant by periosteum? Periosteum is the protective covering of bond. We have many bonds like 206. In adult body we have 206 bonds. Each and every bond is covered with a periosteum. That means outer layer of the bond is called periosteum. This periosteum also made up of fibrous tissue only. And another part is where we can see fibrous tissue. We can see the protective covering of some organs like a kidney, lymph node, and the brain. These type of organs are covered with a protective covering. This protective covering also made by fibrous tissue only. And moreover, in our body we have muscle sheath. This muscle sheath also, that means like tendon. Tendon means it's a tissue connect muscle to bone. Okay, here I will tell you an example, and with the picture I will show you. Here one bone is there, like a humerus or femur, any bone. It should be attached with a muscle, then only it will be stable in that position. Is it? This muscle and bone should be attached. It is attaching by what name? Special tissue. That tissue is known as tendon. That and all you will study in coming chapter. In the musculoskeletal system and all you will study very detailedly. Now you just understand fibrous tissue is found in our body. Different parts like ligaments, tendon, periosteum, and a protective covering of some other organs. Okay, clear? Just understand the difference between ligaments and tendon. Ligaments are the tissue covering, tissue binding between bonds, and tendons are the tissues attaching muscle to bone. This is ligaments to bone, bone to bone, and this is muscle to bone. You understood? Fibrous tissue. Next we will study the another section of dense connective tissue, that is elastic tissue. Elastic tissue. Here it is fibrous tissue. This is elastic tissue. Elastic tissue is capable of considerable extension and recoil. Elastic. What is meant by elastic? It can be extended and it will be recoiled. That type of tissue is called elastic tissue. Even we are flexing or folding and nothing will happen. Everything can be done with this type of tissue. It is elastic tissue, and it is found in different types of organs, like for example we can say blood vessels, large blood vessel wall, trachea, bronchi, lungs. These type of organs are made up of elastic tissue. Understood? Here we are finishing dense connective tissue. Mainly two. The dense connective tissue means it is much thicker than loose connective tissue, is it? And it contain more collagen fibers. In the two types of dense connective tissue is there. One is fibrous tissue, second one is elastic tissue. Fibrous tissue means it's contain more collagen fibers with a very little matrix, that is fibrous tissue, and it is found in ligaments, periosteum, protective covering of different organs like kidney, lymph node, brain, and muscle sheath like tendon. Okay. Next, the second one is elastic tissue. It is having the speciality of elasticity means this tissue is have the capacity for the extension and recoil. Okay, and it is found in large blood vessel walls, trachea, bronchi, and lungs. Okay, here we are finishing dense connective tissue. And next one is blood. But here we are not going to study related to blood because blood is a big chapter. Blood itself is a big chapter and we will study in the next unit. Okay, next unit we will see. Once our cardiovascular system and blood circulatory system comes, we will study detailedly. Okay, so no need to study here. Just you understand fluid connective tissue means including two types of tissue, that is blood and lymph. Okay, both we will study in the separate chapter. Okay, next classification is cartilage in the connective tissue. Another classification is cartilage. Another section is cartilage. Okay, it's very important. You will get more question from cartilages because like on word questions, on means MCQ questions or 2-mark questions. So most of the question papers I have seen at least one question from cartilage they will ask. Okay, cartilage. What is meant by cartilage? It is firmer than other connective tissues. The cells like chondrocytes. Okay, cartilage. The cells in the cartilage is known as chondrocytes. Cells in the fat cells called fat tissue or fat cells called as adipocyte. Is it? We studied in adipose tissue or fat cell. Adipocytes. Cells in cartilage called as chondrocytes. Chondrocytes, and it is arranged in a separate because it is not like closely packed. The space is there. Okay, cartilage means these chondrocytes or the cells in the cartilage is arranged in a separate. There is a space between the cells. Okay, understood? And lie embedded in matrix reinforced by collagen and elastic fiber. It is included with it contain chondrocytes, moreover collagen fibers and elastic fibers. There are three types of cartilage. You understood? But how many types of cartilage is there? Mainly it is three type of cartilage. What and all? It is hyaline cartilage, fibrocartilage, elastic fibrocartilage. These are the three types of cartilages found in our body. Cartilage means it is little bit firmer than, means thinner, or it's not hard. Cartilage means firmer. Okay, it's not little bit thinner than connective tissue, and the cells in the cartilage is known as chondrocytes, and it is arranged with the it contains collagen and elastic fibers. Based on the structure and function, it mainly divided into three types, that is hyaline cartilage, fibrocartilage, and elastic fibrocartilage. Here you should study the examples also. Most of the time they will ask the examples for types of cartilage. Okay, you just study. First one we will study hyaline cartilage. What is maybe hyaline cartilage? Hyaline cartilage is a smooth bluish white tissue. Okay, smooth bluish. This is the this is a structure. Smooth bluish white tissue is called hyaline cartilage. The chondrocytes are arranged in small groups within the cell nest, and the matrix is solid and smooth. Here you can see chondrocytes means these cells in the hyaline cartilage, they are arranged in a grouped way. Some group of chondrocytes we can see in between. We can see some fluid, that is solid matrix. Matrix we can see. Hyaline cartilage provides flexibility. These have the ability to flexible. That means we can bend, we can fold. Nothing will happen. Okay, that type of tissue cartilage is hyaline cartilage, and support smooth surfaces for movement at joints. Okay, and it found in joint areas. It have the flexibility and it gives support and it have smooth surfaces, and it is found on where, on the end of long bones that form joints. Like in our body we have many joints. Shoulder, for example, I will tell you shoulder joint, hip joint, knee joint, elbow joint. These are the different, so many joints are, mainly these are the important joints in our body. Here and all these, in these joints we can see long bones. The end of long bones we can see hyaline cartilage. Just by heart now, but when you are studying skeletal system, you can see the structure and study, where there you will be knowing and you will be drawing the structure of long bones. There you will be marking hyaline cartilage where it is found. For example, I will draw here. Suppose if it is a bone, here you can the tip of both end of the tip of the bone, one cartilage is seeing, that one is hyaline cartilage. This is the location of hyaline, main location of hyaline cartilage. Okay, hyaline, where and all we can see hyaline cartilage. The first one is end of the, on the end of long bones that forms joints. Okay, moreover costal cartilage, costal means our ribs. Okay, ribs cartilage. Here the, when you are studying musculoskeletal or rib structure, there you will study ribs. Okay, there is one bone, center bone is called sternum. This costal or means ribs will connect with the sternum by what? Cartilage only. Cartilage. That cartilage also hyaline cartilage only. Okay, costal cartilages which attach ribs to sternum, that cartilage also hyaline cartilage only. Moreover, you can see larynx means our voice box, and trachea, windpipe, then a bronchi. These organs also formed by hyaline cartilage only. Okay, where and what is cartilage? Cartilage means another tissue, another type of tissue. It is firmer than connective tissue, and it is made up of a special type of cell. It is called chondrocytes, and in between chondrocyte there is collagen and elastic fibers also. Mainly cartilage is divided into three types, that is hyaline cartilage, fibrocartilage, elastic fibrocartilage. And the first one is hyaline cartilage. It is smooth bluish white tissue, and these chondrocytes are arranged in a grouped manner, and in between we can see the matrix also. In this hyaline cartilage have the ability to flex. Okay, flexibility, support, and it has smooth surface also. Where we can see the hyaline cartilage, the both end of long bones and the costal cartilage, that means the cartilages attach ribs to the sternum. What is meant by ribs? You know, no? Chest bones, that small bones we can see, no? That is ribs in the chest. That is ribs. And the center chest bone is sternum. These ribs to be attached with the sternum by a cartilage. That cartilage is one of the example of hyaline cartilage. Okay, and moreover larynx, trachea, bronchi, these organs also made up of hyaline cartilage only. Okay, clear? Next, second type is fibrocartilage. Okay, this consists of fibrocartilage consists of dense masses of white collagen fibers in matrix similar to that of hyaline cartilage, with the cells widely dispersed. It is tough, slightly flexible, supporting tissue found at the intervertebral disc and semilunar cartilages, and the bony sockets of the hip, shoulder joints in the deep cavities without restricting movement. There and all we can see fibrocartilage. Fibrocartilage is also another type of cartilage, and it is contain white collagen, dense masses of thick masses of white collagen by fibers. Here you can see this is a fibrocartilage structure. This is chondrocytes in the fibrocartilage. This also we can see collagen fibers, thick, dense or white collagen fibers we can see, and the matrix or fluids between the chondrocyte is similar like a hyaline cartilage only, but only the difference is hyaline cartilage is more flexible than fibrocartilage, but fibrocartilage is tough. It is tough. It is little bit hard and is slightly, only slightly flexible, but it provides support. Here we can see the examples, or where and all we can see the fibrocartilage, that is in between intervertebral disc. Intervertebral disc means our backbone, that is vertebra. In the vertebra we have disc. We have, when we are studying skeletal system, that then we will, there you will study detail about vertebra, how many vertebrae are there, what is the location, what are the parts of the vertebra, and all you will study later. But now you just know, in between vertebrae, each and every vertebrae, there is an intervertebral disc that is made up of fibrocartilage. Okay, to protect our vertebrae, to prevent the rubbing or friction between the fibrocartilage and this vertebrae. There is a disc between vertebrae. That intervertebral disc are made up of fibrocartilage. I think this recent exam, this recent, not this one, first, once they started semester exam, no, the first exam, Kerala University, they asked like a fibrocartilage example, and the answer was intervertebral disc only. Okay, examples they given, we have to choose example for fibrocartilage. Okay, it was intervertebral disc. Okay, and another one is in the joint, we can see the semilunar cartilages, bony joints, we can see semilunar cartilages, that also made up of fibrocartilage only. And other things, the big bony sockets and all, now maybe you don't know it's bony sockets, what is meant by bony sockets. And it's like a cup and holder, like this it will come. This shoulder joint, same like that only, hip joint also, one socket will be there, in that only another bone will be coming and fixing. This is bony socket. This bony sockets also, inside this bony sockets also we can see cartilages. That cartilage is also fibrocartilage only. Okay, you understood? Next, third one is, third type of cartilage is elastic fibrocartilage. Elastic fibrocartilage. Yellow elastic fibers we can see in this cartilage. Yellow elastic fibers. Here you can see this is little bit bluish. First one, hyaline cartilage is bluish white, and this is white, and this is yellow. Okay, yellow elastic fibers lying in the solid matrix with the chondrocytes. This is a structure, yellow elastic fibers with the chondrocytes. That is elastic fibrocartilage. And mainly it is found, it's a, for example, common question in this elastic fibrocartilage is the presence of elastic fibrocartilage in the ear pinna. Your ear, external ear we have, that one is called as pinna or lobe of the ear, that is made up of elastic fibrocartilage. Moreover, our epiglottis in our in our body, one lid of trachea, lid of larynx is called epiglottis, that also made up of elastic fibrocartilage only. Okay, moreover, another example, tunica media. Tunica media means one of the layer of blood vessels. Blood vessels is made up of 3 layer. In this, in middle layer is tunica media. Okay, this tunica media also made up of elastic fibrocartilages. This example should be noted. It's very, very important. Okay, here we are finishing the cartilages. Once again, I will tell you, mainly cartilages are 3 types. First one is hyaline cartilage, and the second one is fibrocartilage, and third one is elastic fibrocartilage. Okay, and the another tissue or connective type of connective tissue, that is bone, that also we are not going to study here, because in separate chapter we are going in skeletal system, we will study very detailedly. Bone cells, here we will have a small idea. Bone cells called as adipocytes is fat cell, chondrocyte is connective, means cartilage cells, like that. Bone also, bone is made up of another type of cell, that is known as osteocyte. Cyte means cell, osteo means bone cells called osteocytes. Okay, osteocytes are surrounded by matrix of collagen fibers strengthened by inorganic. It is strengthened, it's hard. Bone means it is hard. It is strengthened by inorganic salt, especially calcium and phosphate. Bone contain osteocyte and another inorganic salt, calcium and phosphate. Okay, and it is strong and rigid, and different types of bonds also is there based on the strength. This first one is compact bond, that is dense appearance and solid. Second one is spongy or cancellous bond, that is spongy or fine honeycomb appearance. Okay, this is second type. These details of the bone we will study in another chapter. Okay, here we are finishing connective tissue. Once again I will tell you in the presentation. Okay, here you can see. Okay, this is a type of connective tissue. First one is loose connective tissue, second one adipose connective tissue, third one reticular tissue, fourth one dense connective tissue, cartilage, bone, fluid. The fluid, bone we didn't study, just one introduction only given because we are going to study detail in another chapter. And fluid connective tissue also, blood and lymph is there, that also we will study in a separate chapter. Here we will not study go detail. Another all portions, other all portion, loose, rents, adipose, reticular, cartilages, everything I explained. Okay, it's very very important. Next classification. Here we are finished two types of tissues. In the first class I told you mainly tissues divided into four types. In that epithelial tissue we finished. Second one is first one epithelial tissue, second one is connective tissue. The two classification we finished. Third one is muscle tissue. Third one is muscle tissue. Okay, where now we will see muscle tissue. It's also another important topic in and tissue classification. You may get different questions from this area also. Okay, here we will study muscle tissue. This tissue is able to contract and relax. Contract and relax. Muscle tissue means our muscles. It have the ability to contract. It can contract, it can constrict, and it can relax, or it can be twisted. Okay, it's not hard one. Providing it, what is the function of muscle tissue? It providing movement. Because of muscle tissue only we can able to walk, we can bend our body, we can twist our body, we can turn to back side, front side, sideways. Everything is possible because of presence of muscle tissue only. Because that's why we are telling this tissue can contract and relax. Muscle contraction requires blood supply that will provide sufficient oxygen, calcium and nutrients and remove waste products. Okay, muscle, for the proper functioning and proper development, growth and development and functioning, muscle needs blood. Okay, through the blood where muscle will receive oxygen, calcium, nutrients, and moreover it with through the blood circulation only we can remove the waste products also from the muscle tissue to outside of the body. Okay, there are three types of specialized contractile cells are known as fibers. Like three types of muscle we can see mainly. That is, first one is skeletal muscle, second one is smooth muscle, and third one is cardiac muscle. What are the three types of muscles in our body? Skeletal muscle, smooth muscle, and cardiac muscle. It's very very important. Just listen. First one is skeletal muscle. What is meant by skeletal muscle? Okay, what are the characteristics of skeletal muscles? Now you can see here. This type is described as skeletal because it forms those muscles that move the bones of the skeleton. Striated. Because why these muscles are known as skeletal muscle? It helpful for the movement of the bone. That's why it's known as skeletal muscle. Skeletal means bone, is it? Okay, it helps. These muscles are found with bone and it is very helpful for the movement of the bone. That's why it's known as skeletal muscle. What is the structure? It is striated because striations can be seen on microscopic examination and it is voluntary. It is striated and it is voluntary as it is under conscious control. We can control the movement of skeletal muscles. Why? We will decide whether I have to walk or whether I have to sit, whether I have to straighten my leg or bend my leg. under our control. That's why it is known as voluntary. It is striated, some straight line like striations we can see in this muscle through our microscopy, not with the naked eyes. It's through microscopic examination we can see the striations, and it is under our control. That's why it's known as skeletal muscle is voluntary. Okay, not these 2 points. Skeletal muscle is striated and voluntary. It is under our control. Although most skeletal muscles moves bones, the diaphragm is made from this type of muscle to accommodate degree of voluntary control in breathing. For example, I told you in our body, hand, leg, everywhere we can see with the skeletal system, we can see skeletal muscle. But other than that, we can tell the diaphragm. Diaphragm means it's a layer, it's a muscular layer between peritoneal cavity. Peritoneal cavity means abdominal cavity. Abdominal cavity and thoracic cavity. It's a separation or muscular membrane, muscle present between abdominal cavity and thoracic cavity, that is known as diaphragm. Okay, diaphragm that we will study in the respiratory system. This muscle also have control by voluntary control. Okay, in reality, many movements can be finely coordinated, like writing, like walking. Everything can be controlled by ourselves. These movements are all possible because of muscle called the type of muscle called skeletal muscle. Because of the skeletal muscle only we can do these all movements, because that's why it is known as voluntary muscle. Skeletal muscle is voluntary. Another important point characteristics is it is striated. Okay. Skating, cycling, walking, everything is controlled by ourselves because of the skeletal muscles only. And another characteristics of skeletal muscle, these fibers or cells, cells in the muscle, cells in the skeletal muscles are cylindrical. Okay, these and all you should not, it's very, very important. Striated, voluntary, cylindrical, and contain several nucleus, and it can be up to, the length can be up to 35 centimeter. The skeletal muscle means big muscle and have long, it having length, good length. Okay, till 35 centimeter. It may be long up to 35 centimeter, and the shape of this muscle is cylindrical, and it have nucleus also. Okay, and once we go to smooth muscle and cardiac muscle also, we will tell the characteristics. So just note this one. Skeletal muscle is striated, voluntary, cylindrical, presence of nucleus, and the length may be up to 35 centimeter. Skeletal muscle contraction is stimulated by motor nerve impulses originating in the brain and spinal cord and ending in the neuromuscular junction. That all no need to study now. With that we will study once we study nervous system and anatomy and physiology. Okay, now we just study the characteristics of skeletal muscle. Next, second type of muscle is smooth muscle. Okay, smooth muscle. Here you can see smooth muscle is all described as non-striated. Okay, here when I explained about striated muscle, I told it is, sorry, skeletal muscle I told it is striated, but in smooth muscle it is non-striated. There is no striation, visceral or involuntary, maybe involuntary or voluntary. Okay, it does not have striation and it's not under conscious. It is not under, involuntary means it is not under our control. Inside stomach, heart, these organs are, we can't control that function and constriction, relaxation of these organs, inner part of the body, that we can't be controlled. That's why there we can see smooth muscle more. Okay, that's why it is known as this smooth muscle is not in our control, it is involuntary. Okay, some smooth muscle have intrinsic ability to initiate its own contraction. Some smooth muscles have the capacity to start its own contraction. That process is known as automaticity. What is meant by automaticity? Automaticity, if any muscle have the capacity or ability to start its own contraction, then it is known as automaticity. Okay, like peristalsis. peristalsis, that and all in our digestive tract and all we can see smooth muscle, and these smooth muscles have sometimes in some part in smooth muscles have ability to start contraction thereon. That capacity is known as automaticity. Okay, and here where at all it's we can see in the respiratory tract, we can see alimentary tract, we can see, and the urinary system, urinary bladder and uterus, everywhere we can see this smooth muscle. The speciality is non-striated, involuntary, and it have the capacity of automaticity, and it is found in the our inner organs. Okay, and the next type is okay, one more thing, it have one central nucleus, and this skeletal muscles have many nucleus, but smooth muscle have one central nucleus. Next, third type of muscle is cardiac muscle. This cardiac, the term itself we can we can know that cardiac muscle means muscle present in heart wall, that is cardiac muscle. This is only found only in the heart wall. This muscle found only in heart wall. That's why it's known as cardiac muscle. It is not under our conscious control. We can't control our heart movement. That's why it's known as it's not under our control, involuntary muscle. Okay. When we see through the microscope, we can see the cross stripes or striations in the cardiac muscles also, like skeletal muscles. In the skeletal muscles there is striation, like that in the cardiac muscles also we can see striations, but skeletal muscle is voluntary muscle, cardiac muscle is involuntary muscle. Okay, in this cardiac muscle, each fiber or cell has a nucleus, one or more branches will be there. Okay, cardiac muscle have nucleus and it have one or more branches. Okay, understood? Okay, and microscopically these joints, there is a branches, no, in between branches there is a joints. That joints is called intercalated disc. This joints is called as intercalated disc. Here you can see this is a joint between muscles. Okay, this is known as intercalated disc. Intercalated, just remember this words, intercalated disc. Okay, just to understand what is meant by cardiac muscle. This is present in the heart wall and is not in our control. That is why it is known as involuntary. But there is striations like the skeletal muscles, and each fiber have a nucleus, and there is one or more branches in this muscle, and between these joints the one striation like a joint place is known as, that is known as intercalated disc. Intercalated disc. Okay, this is all about muscles. Okay, muscle tissue. Third type is muscle, and there are three types, that is skeletal muscle, smooth muscle and cardiac muscle. And the fourth classification is nervous system, that also we are not going to study here. In the nervous system unit, separate anatomy and physiology of nervous system is there. There we will study the structure and functions of nervous system. Mainly just I hear one small introduction is there. We'll read that one. Nervous system means the type of cell in nervous system is called, or structural and functional unit of nervous system called neurons. Okay, mainly two types of cells we can see, that is neuron. That is first one is excitable cell and a non-excitable cell. In this excitable cell means neuron, and non-excitable cells means the supporting cells found near to neuron. That is otherwise known as glial cells. Okay, we can say that like support the neurons. That is a function of non-excitable cells or glial cells supporting the neurons. Neurons are the excitable cells and the glial cells are the non-excitable cells which are giving support for neurons. Okay, here we are finishing the tissue classification. What are the four types of tissue? Epithelial tissue, connective tissue, muscle tissue and nervous tissue. Connective tissue also again is divided into different types. Everything we studied with the three classes. Here we are finishing anatomy of tissue and its classification. Some more topics, some more small topics are there. That one we will see in the next class. In the first unit, some more small topics is there that we will study in the next class. After that, we will study first unit of physiology. Okay, once we finish, one more class is there. After that, we will finish with that class. We will finish the first unit. After that, we will go to first unit of physiology. Okay, everyone, watch and study. If you have any comments or suggestion, any doubt, you just mention in the message box. And if you like the video, just like it. Okay, thank you for watching. Bye bye.